Are you considering a hysterectomy? These are some general considerations for you. So one thing is, since the uterus will be removed, you won't be experiencing that uptick in inflammatory prostaglandins that happens cyclically with menstruation, and so you may see this reflected in less inflammation and pain symptoms. The second consideration is if you also have your ovaries removed, prepare for some pretty significant changes in hormonal symptoms. The large majority of your estrogen is produced in the ovaries, so when they're removed, you might notice some pretty significant immediate symptoms of estrogen deficiency like vaginal dryness, low mood issues, sleeping, hot flashes, and skin changes. Progesterone is also only produced by the corpus luteum after ovulation. So naturally, without the ovaries, you won't be ovulating anymore. So you might also experience symptoms of progesterone deficiency like low mood, anxiety, sleep issues, mood changes, low energy, and even muscle loss. The third consideration is that a hysterectomy is not a cure for endometriosis, but it is a cure for adenomyosis, since adenomyosis is specific to the uterus. The fourth consideration is that if you have the uterus removed, you're no longer going to be having heavy bleeding, if that is a symptom that you were living with previously. Heavy blood losses can definitely contribute to iron deficiency, which can drive more pain and pretty extreme fatigue. So if your iron normalizes as a result, you might actually notice some positive changes in your energy levels and your inflammation. But also keep in mind, if you are supplementing iron, that you're probably going to want to audit your supplementation because you might not need it. And high iron oxidizes quickly, so you want to be mindful of the amount that you're taking in and just monitor your levels. The fifth consideration is that although the ovaries are your dominant site of estrogen production, you can also have adipose tissue production of estrogen. So this is estrogen produced from fat tissue. And while it's only a small source of estrogen, it can be the reason why some women continue to experience hormonally driven symptoms after a hysterectomy with ovaries removed. Okay, the next point, I already kind of alluded to this, but a hysterectomy is not a cure for endo. It doesn't address lesions on the bladder, the bowels, the ovaries, on the pelvic walls, in the thoracic cavity, wherever it might be located. So it's not a guarantee that symptoms of endometriosis will resolve. Next point, with any surgery, there's always the risk of scar tissue introduction. This can be minimized by the skill level of the surgeon. Okay, and lastly, if ovaries are preserved with a hysterectomy, there's a 62% chance of recurrence of endometriosis. I'd love to hear from you. Are you somebody who pursued a hysterectomy for endometriosis or adenomyosis symptoms? How are you feeling now? Let us know in the comments below.